Hey there, because you click on this video, that means you are interested to know me. By the way, I am a drug that belongs under the respiratory system. I have a lot of names. My generic name is carbinoxamine. My brand names are Hestex and Palgic, and my chemical name is a bit complicated, so here it is.
For my drug classification, for therapeutic classification, I am an antihistamine, while in pharmacologic, I am a first-generation H1 antihistamine. Let's go now for my pregnancy category. I know you're all wondering if I am safe to be taken by a pregnant woman. Am I safe? Well, the answer is no, because my pregnancy category is pregnancy category C, which means no studies have been done in animals and there are no well-done studies in pregnant women. Carbinoxamine should be given to a pregnant woman only if clearly needed. It is not known if carbinoxamine will harm the developing fetus. I am definitely sure that as of now, you have many questions in your mind about me, like, how does carbinoxamine work in the body? Well, that question will lead us to the pharmacodynamics of the drug or the mechanism of action. So carbinoxamine, an ethanolamine derivative, is an antihistamine with anticholinergic or drying and sedative properties. Carbinoxamine appears to compete or antagonize with histamine, which is type H1, from binding to the HA receptor site on effector cells in the gastrointestinal tract, blood vessels, and respiratory tract.
Let's proceed to pharmacokinetics. In terms of absorption, I am well absorbed following an oral administration, and my distribution is unknown. I am metabolized by the liver and I am excreted in urine. Using the oral route, my onset is unknown, my peak is 6 to 7 hours, and my duration is 12 hours. And by the way, my half-life is 17 hours. For my indications, I am usually a prescription medication used for the treatment of the following. First is for seasonal and perennial allergic rhinitis, or the allergies of the nasal airways causing runny, itchy nose, and nasal congestion. Second is for vasomotor rhinitis, or the runny nose not due to allergy. Third is allergic conjunctivitis, or the inflammation of the membrane covering the white part of the eye due to inhalant allergens and foods. Next is hives and swelling under the skin, or the angioedema caused by allergic reaction. Next is dermatographism, or the skin disorder characterized by the skin becoming raised and inflamed, usually hive-like, when stroked or rubbed with a dull object. Next is for the treatment of allergic emergencies, and lastly is for the treatment of allergic reactions to blood or plasma.
I also have contraindications and cautions, so the nurse should be responsible enough to assess the status of the patient. I am contraindicated to the patients who have hypersensitivity, including sulfite allergy, to those patients who perform breastfeeding because it is risky for the infant. I am also not recommended to those patients who are concurrent use of MAOIs and to the children who are less than 2 years old. I am also used cautiously to those patients who have increased intraocular pressure or narrow-angle glaucoma, hyperthyroidism, cardiovascular disease including hypertension, stenosing peptic ulcer or pyloroduodenal obstruction, symptomatic prostatic hypertrophy or bladder neck obstruction. Elderly may also be more susceptible to adverse reaction. Pregnant women should use me only if clearly needed, and younger children may be more sensitive to sedation or excitation. Let's move on to decide on adverse effects that I can give to those patients that will take me. First, for your central nervous system, you can have chills, confusion, dizziness or faintness, sleepiness, and headache. For the special senses, blurred vision, bleeding gums, dry mouth, nose, and throat, double vision, difficulty in swallowing, and swelling of the eyelids or around eyes or lips. For the cardiovascular system, the patient may have fast, irregular, pounding or racing heartbeat or pulse, tightening of chest. For the digestive system, stomach pains and black stool are noted. For the respiratory system, cough and difficulty in breathing. For the urinary system, decreased frequency in urination and painful or difficulty in urine.
Now let's move forward to the nursing responsibilities, or the things that a nurse must do before, during, and after administering me to the patient. Before the therapy, you must first assess for allergy symptoms like rhinitis, conjunctivitis, hives, etc. before, and can be periodically done also during the therapy. Next is assess for lung sounds and character of bronchial secretions. Maintain fluid intake of 1,500 to 2,000 ml per day to decrease the viscosity of secretions, and assess for increased uric acid levels for lab test considerations. During the therapy, administer me exactly as prescribed. My dose should be individualized based on the severity of the condition and the response of the patient, and then start with lower doses and increase as needed and tolerated, and then give me orally or by mouth only. Measure me with an accurate milliliter measuring device or ml measuring device. After the therapy, monitor the patient's response to me or to the drug, monitor for occurrence of the mentioned adverse effects, provide comfort measures to help the patient tolerate the effects, and then monitor the effectiveness of comfort and safety measures and the compliance of the patient with the regimen. Now let's move on to the patient or family teaching. Instruct the patient to take the medication as directed. I may cause dizziness and drowsiness, so caution the patient to avoid driving or other activities that require alertness until the response to the medication is known. Advise the patient to avoid taking alcohol or other CNS depressants concurrently with this drug. Advise the patient in case of missed dose to take the missed dose as soon as the patient remembers it. And if it is almost time for the next dose, advise to skip the missed dose and take the next dose at the regular time. And advise not to take 2 doses of carbinoxamine at the same time also. And then advise the patient that good oral hygiene, frequent rinsing of mouth with water, and sugarless gum or candy may minimize the dry mouth. The patient should not notify dentist if dry mouth persists greater than 2 weeks. Instruct also the female patient to notify healthcare professional if pregnancy is planned or suspected or if breastfeeding.